This episode of Distraction is sponsored by Landmark College, the college of choice for students who learn differently. Visit lcdistraction.org to learn how Landmark College supports students with ADHD and other learning differences. Find your place at Landmark College. Hello, this is Dr. Ned Hallowell, and welcome to Distraction. I know on your mind, like all of our minds, is the question of the coronavirus and the disease it can create called COVID-19. And while I'm not an infectious disease specialist by any means, I am a doctor, and I actually did visit my physician for my annual checkup this morning. She's a wonderful woman at Brigham and Women's Hospital, Harvard Medical School. She's a professor at Harvard Medical School, and she is very much up on what the latest thinking is. So I thought I'd share with you what she's taught me, what I've learned, what I'm advising my patients and myself, and, what I think is a reasonable approach. First of all, this coronavirus, there are various coronaviruses. The SARS virus, for example, SARS stands for Severe Acute Respiratory Syndrome. Back in 2003, that was actually had a higher mortality rate than the current COVID-19. On the other hand, the regular seasonal flu virus, which kills every year between 5,000 and 20,000 people, only 1 out of 1,000 who get infected die. So its mortality rate is, well, you do the math, 1 out of 1,000. On the other hand, with COVID-19, the mortality rate is 20 times that, 20 to 30 times that, 20 to 30 per 1,000. Still low, we're talking 20 to 30 per 1,000, but we're saying, like 2% instead of 0.1%. So the COVID-19 is a good deal more lethal, but still the mortality rate is low. Higher in people like me, I'm 70 years old, that immediately puts me at greater risk. Higher in people with respiratory ailments, immunosuppressed people, those are the higher risk categories. So what can you do to avoid getting it? Well, the safest thing to do is an option that we hope we don't have to resort to, which is namely never leaving your home and making sure no one in your home has it. That way, it's extremely unlikely you could contract the virus unless someone walked into your house and sneezed in your face. But complete social isolation, quarantining yourself, which some people, like Senator Ted Cruz, have done, is a pretty extreme step that most of us would like to avoid taking. What can you do? You can wash your hands frequently, because this virus can get transmitted from hand to face. You get the virus through your nose, your mouth, or your eyes. So any transmission, let's say you hold a doorknob and the virus lands on your hand, and then you use your hand to touch your face, and it drifts past your mouth, eyes, or nose, you can infect yourself via your hands. However, if you're washing your hands frequently, then your chances of picking up the virus from touching something goes way down because you will have washed it off. So it's worth it to develop a little OCD and start washing your hands, 4, 5, 6 times a day. And really wash them. Don't just rinse them. Wash them with soap. Take 20 seconds to lather up and, do a really good hand washing. Just imagine you were going to perform surgery or something with those hands. You want them to be bacteria-free. So that's the hand washing approach. And then the other is not getting close to people. Not touching people, certainly, but not even getting close to them. And this is much more difficult. You want to keep a distance of 6 feet if you can. The closer you get, the more likely, if they cough or sneeze, the droplets you could inhale or have them get onto your body, and then you touch them and move them up to your face, and they go through one of the portals, eyes, nose, mouth, and down into your system. So try not to come into close contact with people. Now, what does that mean? Well, Saturday night I took my son Jack and we went to the movies. That is something that I shouldn't do if I were really afraid of contracting the virus. The movie theater was noticeably less full. Jack and I often go to the movies together on Saturday, and it was probably, 1/3 less crowded than it usually is. I can foresee the time coming where basketball games will be empty and hockey games will be empty and theaters will be empty. I can imagine that because people want to do all they can not to expose themselves to possibly contracting this virus. I think you should be guided by the facts, of course, but then you do your own risk-benefit analysis, and it comes really down to that. Some things you don't want to do, in these kind of crisis situations can bring out the worst in human nature. People have been stockpiling surgical masks, obviously making it impossible for those who really need them to get them. That's a really selfish thing to do. Others have been not only stockpiling them, but then selling them for, $10, $20 for a mask, which normally costs a cent. Selling them on eBay, you can believe that, and eBay has now forbidden that. You can't do that. Same thing with Purell. That's very hard to get. Same thing with various kinds of antiseptic sprays. So try not to use this moment, not that any of you listening to this would, as a chance to hoard, gouge, cash in on, kind of loot the general public. And then watch out for the racist tendencies this can bring out in folks. There was a video clip of someone spraying an Asian rider on the bus with Febreze. First of all, as if spraying with Febreze would do anything, but more shockingly, the fact that he would just pick an Asian person and spray him with what he considered to be a toxic substance. It's ignorant, it's primitive, it's, in every way despicable. Watch out, because we all have in us the little germs, to coin a term, of being primitive, despicable. It's in all of us. It's in human nature. So don't say to yourself, well, I would never do that. Just make sure you keep in check the part of you that actually has the capacity to do that, because we all do have it. Try to be guided by what smart people around you are doing, smart, informed people, because a lot of people who are smart are not informed. And a lot of people who are informed are natural-born overreactors. I actually have a patient who is buying land in New Zealand as we speak with the intention of moving there the minute the problem becomes worse. If I had enough money to do that, would I do that? No. But I hope I don't live to regret it. I hope or die to regret it. That there is that possibility. But I think if you keep in mind the basic numbers, the chances for death, particularly if you're young and healthy, are very, very slim. Your best bet is to use the simple precautions, the hand washing, keeping your distance from people when that's possible. Obviously, if you're on a bus or an airplane or a movie theater or a basketball game, that's not possible. I was in church on Sunday, and part of the Episcopal service is, it's called Pass the Peace. You shake hands with the people around you. Well, we dispensed with that. We said we'll do the passing of the peace with an elbow bump. And communion this past Sunday did not include wine, because wine, you take a sip from the chalice, the chances for virus transmission are there. Instead, we just had the bread without the wine. So, it's impacting all aspects of our lives. I think if we sort of band together and get guided by what others in our area are doing, then we can sort of keep a handle on it and not overreact, but not underreact. There is a danger, for sure. And this is a particularly problematic virus because it can take up to 14 days to become symptomatic. So you can transmit the virus without knowing you even have it. And that makes it particularly difficult. But at the same time, remember, If you're young and healthy, your chances of dying are negligible. And if you're careful, your chances of contracting the virus go way down. You want to check in regularly with the CDC website. That's cdc.gov. That's where the most reliable information is. And try to steer clear of the fearmongers, the gougers, the exploiters, the people who want you to go crazy and buy up all the toilet paper at Costco. Also, be careful of the people who want to minimize it, the politicians who say everything's just fine, we have it under control. We don't have it under control. That's simply not true. On the other hand, we don't want people going off half-cocked and overreacting. It's hard to know exactly what to do, so I would suggest you take guidance from what other smart, informed people you know are doing, what your doctor is suggesting, what the CDC website is proposing, and then make your own decision, which has to be revised and brought up to date pretty much every day now. We're following it, all of us, and working together. This country has an incredible fund of brilliant doctors, and they are disseminating the information. I think responsible medical people are your best source of information, be it from the CDC or your own doctor or the websites of the various medical schools will have the most reliable and up-to-date information because their only concern is taking care of you. Well, this is a time for us, again, to connect in times of stress and turmoil. The best thing is to connect, to, as I like to say, not worry alone. So let's worry together, and as we do that, let's problem solve. Because the way out of toxic worry is to get the facts and then make a plan. I've offered you the bare bones of a plan right now, and we may be updating that with other suggestions as the story unfolds. So stay safe, be careful. My own inclination is not to stay home, even though I'm 70 years old, but I'm going to do a lot of hand washing, keep my distance, and see about going to movies. Okay, good luck to you all. Please write in with your comments and questions. Connect@distractionpodcast.com is how to reach us. We always love to hear from you. Look forward to talking with you again soon. This is Dr. Ned Hallowell for Distraction. Distraction is created by Sounds Great Media. Our producer is the always reliable and brilliant Sarah Guertin, and the podcast is recorded, edited, engineered, and in all other ways spiffed up by the dapper Pat Keogh.